All right, so we've got visit 4 through 6. Now those 3 activities right there, you can modify them, you can make them faster, you can perform them, you know, in the office and at home. I like them a lot because you can build upon them. You can add a metronome, you can add just duration of time. So those things can happen over the past 3 visits. And now we're visit 4 through 6. So here, my goal is focusing on really pushing into those visual skills with peripheral integration. So now I'm continuing to educate about binocular system and binocular awareness and tolerance of activity, but I'm going to add in some more difficulty with that peripheral integration. So here, again, my video is not going to work, but I'll play it for you anyways. She's looking at this chart right here in the center. So right here in the center, she's got this chart and she's got these little black tracks here, okay? She's using the red pen light to keep that red pen light in the tape while she's actually reading the chart. So if I play this video here, you'll see that little red light moving, if you can see that. And she's reading Y, L, 4, B, E, A, A, M. And so she's going through that while she's keeping her red light in the line. So she's kind of doing 2 things at once, using that peripheral vision. Obviously, you can move that tape further and further out from the chart, but this again, it was so you can kind of see what I was explaining with her in this session. Also, you can see my chart there on the wall, my 4-corner, my door jam activities there. You can progress to that also. You can do the same thing with this tape activity while you're doing the really large chart. So again, we're doing a little bit more peripheral integration there as well. I love that activity. I saw that at a seminar I went to recently, and I really thought it was great. Okay, so this is an example of what I call sticks and straws. So I literally got a piece of wood, I drilled some holes in it, stuck some straws in there, and used these little pickup sticks, okay? So the purpose here is to improve sustained visual focus and stamina, having her put the pickup stick or small dowel into each straw with precision. So many of my patients actually are people who enjoy needlepoint, or, well, I like to knit on my spare time or something. So this is a great one for those folks specifically. And so she's going to be aiming this stick into the straw, kind of threading the needle as she does this. Again, I'm asking her to do it in brief performance. So if she misses the hole, she comes back up and she tries it again. Not so much that slow, controlled, because that's a little bit easier. So I'll play the video here. So again, she's aiming, she hit that one. She's going to move on to the next one, missed it, hit that one, okay? That's actually really difficult. It takes a long time. I progress that by having them pull that dowel or the pickup stick farther and farther behind her ear. So at last, she's back here, okay? So she's aiming for that straw, but she's back here. She started maybe in front of the straw, pretty close to the object, but as I continue to grade the activity, she's pulling her hand back behind her ear. So this, again, is an example of what I would give to the patient. I have this little snippet of what my handout looks like, and then I give them a whole paper of these O's. Oh, I'm sorry. I give them a whole paper of these O's to dot at home. We don't have to take this block home with them. And I give them a stack of those, like 20 pages of them. All right, then we have the trusty Brock string. Most of you guys know what this is and how to use it. Particularly for her, I introduced this at visit number 7. So that's 7 weeks in, and I started the Brock string because I don't typically do this early on. At this point, she's aware of physiologic diplopia. She's aware of how her eyes should feel when she's converging versus diverging. She understands kind of her area and space. And I think it's really important things to establish before introducing the Brock string, as it can be kind of upsetting to folks if those things are not kind of focused on or addressed earlier on. She's standing in a corner here. That's just kind of a more safe option. As she was also, side note, seeing vestibular therapy while we're seeing each other, just to kind of give you guys an update. Here she's kind of moving her eyes from the red to the yellow to the green, and in different orders, making sure that she's seeing the single vision of the beads she's focusing on, while double vision of the other things. Again, this is kind of that physiologic diplopia, but in this very near range. That closest beat in this example is about 5 inches away, which is kind of where she had that break when we first met. And then they're set apart about 12 to 16 inches between each beat.